Today we're gonna try something different, and I need you guys to help me out on something. I've been producing a couple of videos where we're going through the same motions and being all, hello everyone, today we're gonna talk about biology. And I feel like there are already a lot of pages on YouTube, you know, the ones that take care of all the boring stuff anyways. So I wanted to start making videos that are actually fun to watch instead of you guys having to sit through another lecture like any other. What you have to do is go through this one, and if you actually like this kind of stuff, I want you to leave a comment that says not cringy, so I can continue on making weird stuff like this, since I feel like this is more fun to make and this gives me more creative freedom.
Nice.
And if this is weird or cringy in any way, then you guys can still comment down below and I'll know, and we'll go back to our serious lectures. Oh, and we will still go over the whole topic, and we will still be very accurate according to Davidson's Principles of Medicine and Oxford's Clinical Handbook and the First Aid Book and the NICE guidelines. I still go through all of these myself. Okay, so without further ado, let's get into this. Now this is actually a pretty important video both theoretically and clinically. We'll go through the definition, pathophysiology, symptoms, diagnosis, and the actual management of it. So let's go. So thyrotoxic crisis is a life-threatening complication of thyrotoxicosis. We've already gone through a lecture on thyrotoxicosis and hyperthyroidism, but when it goes on without the patient actually knowing about it, or if it's not treated properly, or if there's any added infection and stress on the patient, the thyroid goes into full-on rage mode, starts releasing a lot of T3 and T4 in the body, and all hell breaks loose. This is also seen post-thyroidectomy immediately after a surgery. Similarly, when radioactive iodine therapy is given, the thyroid follicles and cells start breaking up. That releases too much of the good stuff in the body, therefore causing a transient rise even to the point of a thyroid storm, and therefore actually decreasing the thyroid gland mass to a level where it causes hypothyroidism. Now the patient, when they come to you, is going to be hot. No, not that kind of hot. They'll be having fever. They'll be really agitated and delirious. Their heart's gonna be racing. They'll have AFib or atrial fibrillation. But how do we know if a storm is coming? We use the Burch Wartofsky score, which uses temperature, cardiovascular tachycardia, congestive heart failure, GI and hepatic dysfunction, central nervous system disturbances, and precipitant history as a criteria to give points to the patient. And if the points are 25 to 44, the patient is in an impending storm, and more than that means that the patient is in fact in a thyroid storm right now, and they need to be managed. Speaking of which, patient needs to rehydrate. We're trying to dilute out all the hormones that are in the body. For the tachy, we start by giving propranolol in an IV infusion of 1 to 5 mg 4 times a day, or orally at 80 mg 4 times a day. We go on to sodium epodite at 500 mg orally, and this will normalize the T3 in 2 to 3 days. We add on steroid like dexamethasone at 2 mg 4 times a day, and then move on to carbimazole, which is an anti-thyroid drug, at 40 to 60 mg a day. You can place it up the bum if the patient is unconscious. And we might need to do this treatment for 10 to 14 days until the storm subsides, and then just maintain on carbimazole. Now let me know what you feel about all of this in the comments. Otherwise, we're going back to the normal lectures.
Thanks for watching, you guys. You can go check out more videos on the channel. Do leave a like and subscribe for more content like this. If you have any questions or suggestions, you can leave a comment down below. I'll see you next time.